Turbo? You want turbo in here?
Alright, the purpose of this video is to show you how to hook up the 250 milliliter bag of D10 in place of the D50 that we don't have anymore, we can't get supplied. So I don't use this and use this up and waste it. I'm going to use this in place of it just for an example. So for now, this bag is actually this bag, but I just don't want to take it out. I'm going to waste one of these. We're going to use a 10 dropper tubing, and then this is the D10 bag. Alright, so prior to you spiking the bag, of course you're going to clamp your tubing, and you want to burp this bag. So you have air up there in the bag, and you want to burp that out of there. If you don't burp this bag, and remember this is the dextrose bag, when you give this to your hypoglycemic patient, if you don't burp the bag, and this is all hooked up, the tubing, about this much of tubing will be full of air. And if you want to transport your patient to the ER now, you just can't unhook this bag and hook up a new saline bag and flush that air into them. You're going to have to expel the air somehow. So you do that by burping the bag. So how you burp the bag is the air now is at the top or at the bottom. Get rid of that, get rid of that, and you're going to just pierce that a little bit, and that allows you to put pressure on the bag and force that air out. And you're going to force that air out just so it comes to the tip, and then you're going to insert your tubing, hook it up, undo your clamp. Undo your clamp here, you can flush your tubing. And now that it's all the way flushed, just hook it to your patient. All of this, remember this is D50 or the D10, all of this D10 will go in, the bag will go flat, and you'll still have IV fluid remaining in the tubing. And then when you're done, when the bag is flat and complete, you're going to clamp off your tubing. Just unhook it, go get another IV bag, and you don't have to burp it for the second one, you don't have to, and just put it back in there, and now you can transport your patient and you will not have air in your tubing. So that is burping a bag.